Hi everyone. So I'm here again with Dr. Nario. How you doing, Doctor?
Pretty good. How are you, Steve?
I'm good. So as you know, Dr. Nario is with Biointegrative Health Center in Reno, Nevada. You can check them out online and see all the different treatments and cool stuff that they do. So, and if you want to know more about our weight loss program, use the QR code on the screen or the link in the description. You can find out more about that. All right, so we're going to talk about red light therapy. So there's a number of different red light therapies. So do you want to tell us the different ones first?
Yeah. So, Steve, this is something that's becoming like a fad out in the open. You would hear that there will be spas, saunas, salons offering red light therapy. And what is it really? What is bring? Does it bring to the table? What does the name mean? And what do we need to know about this in relation to our health? So let's define terms here first. So photobiomodulation or PBM is what the real name of these devices are. So we always hear about red light therapy, we hear about level laser therapy, and even near infrared, far infrared. So this is just involving application of low power light to the body to stimulate cellular function. So we'll go into the details of that, and there's different levels, especially for our athletes out there who are interested in these types of modalities in terms of how it can help your health, workouts, recovery, whatever you want.
Okay, so we're going to definitely get into the benefits and why athletes or somebody that anyone who's in the gym who wants to improve their performance, why they would use red light therapy, and you talked about some of the different ones. So we should probably find out, when's the best time, how often, and all that. So, what are the benefits?
All right, so let's go to the specifics first. For athletes, what is the benefit of photobiomodulation? So we'll define this a little better later. So you need to first know what type of infrared light you're going to be getting. But in general, the infrared light that you will get will stimulate cellular function, especially ATP production in the mitochondria, and this will actually increase more the energy production for your system, and that's why it even lowers oxidative stress, especially like for post workouts, and even modulates inflammation after working out. So the ones proven in terms of the effects for athletes would be improved performance. So this is specifically better for endurance athletes, or even reduces the time to exhaustion. And it also makes your muscle adapt more to the oxygen uptake or the demands during exercise. And also, it lowers down fatigue, lowering down lactate production, meaning the lactic acids, and increasing VO2 max and muscle recovery. And that's when we talk about muscle recovery. We lower down the inflammatory markers after an exercise. It increases repair and making you go back to baseline faster after a strength training exercise. And also injury prevention. So basically, even rehabbing athletes. This promotes collagen remodeling, formation of blood vessels, and also reduces the delayed onset muscle soreness or DOMS, as we always hear in the world of athletics, and joint inflammation. So you mentioned, when is the best time to do this? Pre-exercise studies had shown that it actually enhances strength and endurance, increases the number of repetitions performed, and even improves muscle strength. So peak torque, maximal voluntary contraction, and length time to fatigue onset. Post-exercise studies had shown it accelerates muscle recovery, and that's why there is just improvement of resiliency and lowering down of injury risk and inflammation. So as you can see, it can be used pre and post for athletes.
It sounds like there's a big benefit for endurance athletes, someone who's doing distance running or cycling or something like that. You kind of mentioned that at first. Is that right?
Yes, so that's actually for the performance, but I think the weightlifters or resistance trainers out there can definitely benefit from this as well, especially the the delayed onset muscle soreness after lifting. or even recovery, because you have to remember that there's a lot of injury related to, especially for the heavy lifters, in relation to the recovery and the cytokines inflammation that's produced after heavy lifting.
So a weightlifter, you said would be best to do this treatment after?
It would be, but for me, it will actually be both. Either it's just that it's so time consuming when you do a pre and a post, and also if you don't own the machine, you're gonna these things are not cheap. You have to pay for like a subscription. You have to go to specific facility. But if you have your own machine, hey, pre post whatever, do it. I highly recommend it.
What does this machine look like?
It comes in so many different forms. So the one that probably is more affordable for patients would be panels, like a box, and then you can just stand in front of it, and the light will just flash. May it be like a small box, a long, elongated mirror. So there's so many sizes for this, and there are also what we call applicators. So it can be in like a strap. You put it on your abdomen if your abdominal area is painful, or it can be a strap for the biceps, like a blood pressure cuff. That's also another one. Or they can be in form of flashlights, like on joints, right? You can put it on joints or target specific body parts like your cervical area. And for the brain also, and even for hair, I've seen it, helmets. So they can be used as such, even for targeting concussions and even brain enhancement. And the one that I think that other people have who can afford are what we call sauna, infrared saunas. So these are the big boxes, or you can even install it as big as you want it to be, and you go in there. It's almost like your regular heat sauna, but it's the bigger form of these infrared light delivery methods.
Yeah, we have a sauna, infrared sauna, but you don't see any red lights or anything in
That's
there.
a good. All right, so it's a good thing that you brought that up. The thing here is why is it not visible? So you have to remember, red light is colored red because this is actually a certain wavelength. So we're talking about, so when you talk about far, near, and red, it's all about the different wavelengths of light. So that why it's red, it's because it only reaches that certain wavelength. So that's called red light is always called near infra. I'm sorry. Red light is just basically surface exposure of red light therapy. When you now go into the near and far infrared, you would notice that these lights are not red anymore. They're just basically they're colorless because they penetrate deeper into the tissues. So when it's red, you would know it's a clue for you that it's only superficial. But when it's colorless, then you know it goes deeper into structures. So it's relation in relation to wavelengths.
Interesting. Yeah, ours doesn't have any light. You can't see any red lights. Now, my wife does have one of those panel things, and that is red.
Yes. So that's
But
why
the
you
sauna
need.
is just, I just know that you don't have to, it doesn't heat up as much as a regular sauna.
That's right. So that's why it's even sometimes, yeah, you don't feel it. But the clue here, when you're talking about the if how it's working, is when you know things are starting to heat up, because that's when the metabolism, the cells are getting stimulated, especially for the near infrareds and the far infrared classifications.
Okay, and what's the difference between the near and the far?
All right, so now let's go into that specific discussion. So, as you mentioned a while ago, red light, right? Red light is actually the wavelength of this. Again, you don't have to remember this 600 to 60 to 680 nanometers, so nms. So, meaning the thing that you just have to remember is when you see red, it only hits the surface of the skin, but it still hits the ATP or the mitochondria of the cells on the surface of the skin. So this is good for skin problems, skin healing, post-op procedures, even for like pain on the superficial muscles. When you now talk about near infrared, it's 808 to 850 nanometers, but now it goes a little deeper. So this is now the muscles, the tendons, the joints. So this is the one you want for joint recovery, deep muscle stimulation, and even nerve repair. So the next level to that is actually near or mid infrared, so around 980 to 1000 nanometers. It goes into a deeper type of penetration. So you still get the joints, the muscles, and tendons, but Again, if your injury is a little deeper, then the for the near infrared, you go for the mid infrared. And now far infrared, here's the bigger eye opener for me. It doesn't work the same as near infrared and mid infrared because it does not increase the ATP for the mitochondria. What it does, it actually generates heat. It's more of thermal regulation. So
That's the
that's how
sauna.
I mean, not only the sauna, there are also light devices that are for far infrared. But the point there is, it's not going to be having the effect of what we're talking about in relation to mitochondrial stimulation. It's really more of a systemic, deeper, because it heats up the blood, the red cells, and that blood that's heated up now goes into the system to promote detoxification, healing. And as you can see, it's not a targeted approach anymore because we want it on muscles for the athletes, right? But this one is more for detoxification, generalized inflammation, systemic effects that you want to see. So really, if you imagine this, how infrared light works, it has a sweet spot. If you really want to get to that specific objective of stimulating mitochondrial ATP production, if you go farther, you're going to miss that. Is that a disadvantage? Not really. It's still a benefit, but it's now, if let's say your objective is just for targeted therapy, you're not going to hit that with far infrared. So I don't know if that made sense to everyone out there, but yeah, be cautious, learn more about this, especially with the devices that you buy, and especially the goals that you have in relation to why you're buying these devices or using these devices.
Yeah, if you guys have questions, put them in the comment section. I'll make sure the doctor gets them. So I do know this. I did a little experiment with our sauna, and I checked my blood pressure, and my blood pressure is always pretty good. But then I'd get in the sauna for 20, 30 minutes, and I did this, I don't know, 3, 4 days in a row. And
Uh-huh.
when I got out, I checked my blood pressure, and it had significantly dropped. And
Okay.
that kind of surprised me how much it went down. I mean, it went down almost too low.
To the
Um, I mean, before it was maybe 115 over 70. And then
uh-huh.
I got out of the sauna and I checked it again and it was like 100 over 60.
Right.
That's a significant drop.
Right. So that's a testament for you. And I have to say that more of the far infrareds are available in the sauna form, right? And as I mentioned to you, it's a systemic effect. When you talk about blood pressure, it's not something that you're going to see in terms of the effect of a near red light or a mid infrared. It's really more for the far infrareds because one of the effects of far infrared would be vasodilation, improving oxygen and nutrient delivery and waste products removal through the body. And that's why this is something, again, what you felt is a systemic effect. So, probably a good analogy to put in our brains, how to remember this better, is far infrared systemic, the other ones more local.
Yeah, I mean, I was just like, whoa.
Yeah, it can happen.
It
So,
it's I mean, I was shocked that it would make that much of a difference in 30 minutes.
here's
I mean,
another.
maybe it's just me.
Yeah, well, another question that I always get from patients would be, hey, should I just go into a regular sauna versus the far infrared? I always tell them that it's always good to get the far infrared. The reason for that would be the penetration, the systemic, deeper effects of it. When you talk about regular sauna, it's just heat, it's making you sweat. Again, it's a detoxifying process, but it doesn't have that stimulation going through the tissues and even going to the blood as deep as a far infrared. It's still good. I wouldn't say that, hey, at least get something if you only have the regular sauna in the gym. That's fine. But if you have a far infrared, way better.
Yeah, amazing. Well, I'm surprised you didn't say, "Oh, you're making that up, Steve." Uh,
No, I've seen that before.
yeah,
So
yeah. Like I said,
it,
I don't know if it's like that for everybody, but
you're
and
not
like I did,
malingering.
I did this 3, 4 days in a row, and the same thing happened every time.
Really? Yeah, just be careful. Sometimes a big factor here would be dehydration also. As one of the things that we want to make sure that our patients watch out for during these processes would be hydrating, especially with electrolytes, not just fluid, because it's a very intensive process for the system. Because you have to remember that when you talk about far infrared light, we're not only talking about detoxification, we're talking about it produces a lot of endorphins in the system. It also produces affects also brain function because it's systemic, right? It's not just going into the specific muscles. And why I know it's brain because I have patients who actually feels that it actually helps them with sleep quality and even stress reduction. So it might be your adrenals, it might be your brain, but as you can see, that's not usually achieved when you're using a mid or a near infrared sauna.
Yeah, I mean, but that tells you the benefits that you're gonna get from, especially for performance. I mean, getting the blood flowing like that and with just so easily, uh, I mean, for recovery, for everything. I mean, if your blood's gonna flow like that and your blood pressure, I am going, away. Is my blood pressure gonna go too low? You
Right,
know?
right.
Um,
That is
but
true.
that just, I mean, just the response of my blood pressure, that little test I did on myself is gonna tell you all those things are gonna benefit what you've mentioned.
That is correct. And that's why it's something I always and it works well as an adjunctive therapy. I have patients who does IV therapies, hyperbaric oxygen therapy, even cryotherapy. This can and coincide with these other modalities to actually make you achieve better health.
So, a couple more things here. What else would people use it for? Like skin? You said hair. I mean, I've seen the helmets.
hmm
Um, and so skin, they would just stand in front of the panel or
Yeah. hmm So for skin, I recommend this a lot for post-op patients and even for people who has eczema or psoriasis, or even somebody who has a wound that wouldn't heal like diabetics. I'm not saying that's the ultimate healing modality that they will be cured of the condition, but it's an adjunct towards regular wound care that they get from the hospital, or as they control their blood sugars or of course as the healing of the post-op wound as you apply all your ointments and bacteriostatics, all of them will work together. It will just increase blood flow towards that area. As I said, it will stimulate the ATP of these cells that are actually trying to like stick together, so they will do it faster in relation to that exposure to that surface red light.
so is there anything else we should know or something that's cool about these lights or anything that you would add to this?
Yeah, so the thing that I always want to emphasize would be that again, when you thought that red light therapy they're all the same, uh, you have to make sure you know the specific definitions of red light or superficial light, near infrared, mid infrared, and far infrared, because they have specific reasons. Because for me, I have to be honest. I when I started with this, I didn't know what it was. I just thought red light therapy they're all the same, right? But now, as I got into the intricacies of it, now I understand on what to actually suggest to a patient in relation to their specific needs. And it's, being more specific for athletes, there, the most beneficial for the athletes would be from the red light, the near light, or the mid infrared light, because in relation to their workouts. And again, this is one of my bigger eye openers. When you see red light coming out from a machine, it's actually more of just superficial. The one that you really want to see if you want to get deep penetration would be clear light. There's no color to that light. I mean, that's an eye opener for me.
And that's in the saunas.
And anywhere, even with the devices, not only through the sauna.
Interesting. All right. Well, it sounds I just everyone make sure you know what you're getting so
Yes.
that you know the specific benefits that you're getting with the type of red light therapy that you're doing, whether you're in a clinic or whether you're buying a device for your home or going to the gym or whatever you're doing. Just it's beneficial to know the difference, to know the specific benefits that you're getting, right?
And yes, and Steve, I want to give everybody heads up that the technology of red light therapy or photobiomodulation, as we call it, is still growing. Right now, there are studies out there that it can actually help in the halting of the progression of Alzheimer's disease. So they actually now go into these levels of deeper penetration. So when you mentioned about that helmet, right, just for the head for hair, Now, the studies are being ran and considered to actually help remove those plaques and tangles that contributes to Alzheimer's disease. So keep an eye out for this technology. I think there's more to come and there's more promise to photobiomodulation in the future.
That's amazing. Something you put on your head you think can actually benefit your brain?
Yeah, there are studies out there. I mean, right now, I think they just have preliminary studies on animals, but as I think they're starting to get people to start, I guess, in terms of study subjects, they're starting to try to see how this affects them in a way. But in animals, it has been proven to lower down these
Wow.
tangles and plaques.
That's amazing. All right, everybody. So if you have questions, put them in the comment section. If you have experience with this, we'd love to hear, your testimony about this. If you guys want to know more about, the things that I interview with doctors and nutritionists and um, personal trainers, subscribe to the channel. Thanks for being with us, Doctor.
Thank you, Steve, for having me again. As we all know, that knowledge is power, and thank you for letting me provide you with edge of longevity and health maintenance, which I call the biological edge or the bio edge.